Hello and welcome to this edition of 3D, the Development Design Digest, where we look at leading lights in social development who are using design thinking to come up with design solutions. They try and test programs and initiatives, and if they work, if those pilots work, then they scale up. Today, I want to talk about health and nutrition because they're very linked. You can't have good health without nutrition or nutrition without good health. But I want to talk about something beyond just health and nutrition, but about stories, the stories that create us as well, the stories that define us, and that actually encourage people to change their life in different directions, because that's what we have with our associate director of health and nutrition at Transform Rural India. That's a development design practice that focuses on rural India. Now, I'm joined today by Shyamal Santra, who is nothing without the stories that have created him and given him the inspiration to move into this area of development and specifically into health. And it all started with a bus ride, I believe, Shyamal. Shyamal, you are the Associate Director of TRI, focusing on health and nutrition. But I want to start today focusing on your story first, because we've had conversations before about how you began. And I would like to know about a certain bus ride that changed your life.
Thank you very much for calling for this today's conversation. See, how I had started in this sector, it has I'll take it in two parts.
Okay.
That how my family, or particularly my grandfather, has contributed in my upbringing, and second, that how outsider unknown people has influenced me to change my own journey. So if I look back, I had been born into a very deep rural pockets of Bengal, in a family, say agrarian family. But we had a family practice that my grandfather always insisted me two things. One is that we will not have any food unless we do some work. So if we don't have any work, then he used to send us for finding some sands so that I can do some work, then only I can get food. So that was the value of labor or work which we had learned. Second, in a family which we have, when we had grown up, we had farmland. The laborers used to come to my family to work there. But as a family, we had set norms that we have to eat with them for the days they are staying with us. To respect that those who are working for us, we should sharing everything with them. So that's the way I had brought up. Then after my graduation in Calcutta University, I had moved to Delhi, where I was working in a government job. One day I was traveling in a bus. During the travel, I had met a person. He was an unknown person. But during the journey, after a few minutes, he started talking. He is a Bengali person. I don't know what happened, but that conversation went on. And then he shared about his own story. The story is that, not story, it is the life, what I'll say that the life course, that the person used to live in a slum of Delhi. His nephew was doing a PhD in a renowned university. He was murdered, and once the family has reached out there, they were not supported by the faculties and the police and others. I don't know what happened to me, but I had get down with him in his bus stop. I entered into his home, and he was living in a slum. The slum name was Naglamachi. It was one of the largest slum those days in Delhi. It is in 2006 or 2005. But that single incident of entering into a slum in my first time in my life had turned me into a different direction. Eventually, I started visiting repeatedly. I took that the issue to the Human Rights Commission, and it had given me a new step that eventually I started living in the slum.
Oh, wow.
And as I had started living with them, I left my job, then mobilized the local slum dwellers and the children to the schools. And that way, someday, I don't know when it happened, but it has come that I have been dedicated for this work. And then I realized that I met actually one person, again in Safdarjung hospital. There was a class in my slum. So I had took some people to the hospital. The person who was sitting next to me, suddenly has noticed that I am not from the slum community. Okay. So he told me that that how I have been associated with the slum dwellers. And then that interaction again took me to his home at Noida. And after few months, he suggested me that by the time I didn't left my job, I was doing my job, but I was into living into the slum. Then he suggested that you may go for further study, or you may take a different step in your life. Then I realized and took admission in for a PG in development studies, and that's the way that I dedicated myself for this job.
So let me get this right. You met a man on a bus who eventually, somehow through meeting him, he impacted you so much that you moved into the slum, you helped campaign, you quit your job and you campaigned for the rights of the people in that area. And here you are. Wow. That's some bus journey, huh?
Yeah.
Your grandfather would be proud, I bet, huh?
I think he might be.
So how did you move from that into Transform Rural India and with a speciality in health and nutrition? Because a lot of people in this field, a lot of the people you work with are doctors or people who have medical degrees and backgrounds. So how did you shift into that area?
See, it has also a very interesting story. During my PG at in development studies, I had actually stayed with the Bonda tribes.
Okay.
Bonda tribes in Odisha. So my topic of the study was that understanding the market system.
Mm-hmm.
So I was initially inclined to the livelihood issues, because in slum I have experienced that how people are living. Then my second field work during my PG was with the rug pickers, is the waste pickers.
Yep.
So I spent almost 72 days with the waste pickers. Then I had seen that children, how their life is and how they are living their life in a slum again as a waste picker. And as a waste picking became a livelihood. So then it gives me an inclination to the livelihood. So therefore in my third field work in my PG, I took up understanding the local market.
Mm-hmm.
Then I started living in a village in Odisha with the Bonda tribes, with I aim that we will be studying the market, organizing them into primary producers group and helping them for market linkage so that they can get better livelihood. So that was my task. But one thing happened very interestingly. One day I met a woman who was tribal communities coming from Bonda tribe. She had malaria for a long, but she had never gone to the hospital. And she was about to die for many days, but she is not going to the hospitals. Then it gives me an understanding that that it is not, livelihood is very important, but more than that, it is the life which has to be saved.
Interesting.
So then it gives me an instinct, or that to understand that how the local system is working and how it is preventing any person to accessing medical care. Then I asked to my professor, then he had shared a very interesting thing. He told me that if somebody is not looking for his own health or his own life, it is not only health, it is an entire system which is playing there.
Okay.
So you should first try to understand that. And that day itself I had, I don't know what happened again, but that lady had, that case had given me that, what I'll say, that inclination to the health and nutrition sector. And if I look back my own journey in my families or that villages where I have grown, I have found it very differently. What happened that in the area which I have grown, that area is cut off. It is a very remote area, and each year it got flooded for 3 to 4 months. So this area people has migrated a lot for different work in the outside. They get economic benefits, is true, but once they migrate, they leave the family members at the family. And the new kind of diseases, including HIV/AIDS and others, that actually comes through that route to my areas. So which I was never noticed it earlier, but with this case, with that woman, it has actually helped me to reflect on that how living healthy has a larger impact into the other sphere of the life. And that's the way I had been entering into health, and I have developed the interest into health. Again, I am not a health specialist or or health. But what I found always that life has to be looked into a rainbow. Life means everything. It's about healthy. It is about celebrating. It is about joy. It is about living, enjoying, connecting with people, and to do everything, anything. Health is the prime. So if you ask me what is health, for me I always call it is a swastha to mast hai. So if you are happy, then you are healthy. So that's the way I look health.
And I love this too, because it kind of fits into the whole idea of design thinking and solution designs, because you can't fix a problem through a tiny lens. You have to look at the whole of the person. So creating a job for a person, great. But if they don't have good health, that job, that livelihood, that money is for nothing. So so you're looking at the arm where you go, let's go back to the basics first. Let's make sure that people are healthy. And health also doesn't just mean going to the doctor once a year, it means a healthy living. So they're all interrelated, but I want to come back a little bit to health and nutrition. Why is it so important to you and to TRI to combine those two as an initiative?
See, if we look at TRF approach, that we want to see that locality are flourishing. So if we look that locality is flourishing, how it will be flourish. So if we look in a mythological way, it is Srinivas. Sri is Lakshmi. So Lakshmi is living in our body. Lakshmi is living where we are living, and Lakshmi is our surroundings. So that's the, if it has fulfilled everything, our dream, aspiration and ambitions, then it will be fulfilled. And that's the way TRF looks. Once it's come to health and nutrition, it is the self, body's mind, well-being, nourishment and enjoyment. And without that, we can't think beyond our day-to-day lives. Not only life, if we live, then it is about hope, dreams, aspirations. And for everything, health and nutrition is very critical. Therefore, in TRI, we look at it in that angle.
Okay. I ask because it feels like a lot of people look at health exclusively, and nutrition is something that might be added on, but is also something in a different bucket. But we tend to combine them as a joint initiative, right?
See, for us, it is together. Health is not only about medical aspect of it, but rather it is about social determinants, it is about social norms, and it's about practices and adopting the scientific behaviors. And without, again, that nutrition is about the nourishment, which gives the basics of any human body. So we can't differentiate this together, has to be looked together, and we can differentiate it from one to other.
Right, right. Now, it's not easy though, is it? Because you have a lot of challenges. There's basic infrastructure challenges, getting to people, especially those who are most marginalized or remote. There's a lack of human resources, perhaps, as well. And I suppose, is there also a mindset that is difficult to shift? People just might not be aware of the healthcare choices that they need to make to have a more prosperous life. Tell me, what are the biggest challenges that you're up against day to day?
See, it is very difficult to answer that which is the biggest challenge.
Okay.
These three are the combined challenge which rural India face.
Okay.
It is true that our social norms, behaviors, practices, which is at a home, which is at the community, it has a disproportionate impact into the how the health and nutrition status of the entire life cycle. Second, that apart from this part, preventive part of it, obviously that health infrastructure and the other aspect, particularly the curative and other part, infrastructure, HR, supplies, drug, diagnostics, it has a very critical role into ensuring the universal health coverage for the people. Unfortunately, if we look at the evidences, it is the low cost evidences or low cost practices which can save lives, which can make us nourished. It has to be combined with the infrastructure and others. But if we look at the rural India, it is a great disparity. It is many things which we know, but the solutions are known, but it has not been adopted, or it has not been promoted, or it has not been reached to the people. So that is one part of it. If we look at infrastructure wise, obviously there is a huge gap, but I don't see it two separate things. It two are interlinked. It has to be looked into three parts. We call this in a design thinking, we call this a set. Is social structure, it is the environmental structure, and it is the technological and infrastructure structure. So therefore, to make any places healthy, these three systems has to work together. So that is the way it can work. So I think in rural India, a lot has to be done.
Well, I'm glad you brought in design thinking, because I wanted to know, how are you applying that to these challenges? That's one example, or that's the broad brush. What are some examples of how this is getting applied to rural India?
So how we are looking it in a health, in a design angle, that if we want to see health, health and nutrition, then it has a different systems which is interplaying together.
Okay.
If we again break it down, it is a family as a structure.
Okay.
Within family, there is an individual, is a human being. So as a human being, then it is a family, then it is a society. So this is an entire system which is working. Again, there is a health system which is working, combined with the public system, including nutrition and other aspect of it, and the determinants like water, sanitation, livelihood. So that is one is the system which is working, and another one is that other aspect of life, like your connecting with the society, enjoyment, playing, well-being. So these three systems in a area, it works, it's play, and it has is a different kind of impact into how we live. And health has a connection with everything. So in design thinking, what we are looking, that how these three systems can work together.
Okay.
How different players or the stakeholders can interacting with each other. But more than that, it is important that from a user's perspective, from a perspective of a children, from a perspective of a woman, how they are navigating each of the systems. And during the navigating process, how we are equipping them to take leadership, how we are giving voices to them, how we are enabling them so that they can improve their own agency to living healthy. So that's the way that we are applying the understanding of designing, that how we will be helping women, children and marginalized to navigate through these different systems, and looking is a whole. As I told you earlier, that is a rainbow. So it's a life of rainbow has to look at a whole.
Yeah.
And if we look the health as a health system, then it is a very narrow way to looking health. So in design thinking, we are looking as a whole society, whole of system approach, that how all are interplaying together towards making our life healthy. So therefore in health, we are calling it a celebrating life. It is not health, not illness, not anything else. It is celebrating life.
Oh, I love that.
So that's the way to look how design thinking is playing.
And what's fascinating is most people wouldn't think, oh, a marginalized woman doesn't have a voice or has no agency, that's going to impact her health. Like, you wouldn't immediately think that. You might think that affects her access to, education or resources, or how she's treated in her community. But actually, all of that impacts her health as well. That all has a toll, and if you're not thinking of the whole picture, you're not going to solve any problem.
See, I would like to see it in a different way. Like in India, if we take the public health issue, anemia is a very big issue. Antenatal care or ANC has a very big issue. If we look the data, it shows that one is that your enrollment is very low, first trimester. Enrollment. And again, if we go to the fourth trimester, again it is low. So it is not only the services, it is more than that, that how a woman is playing and treated and given due space within her or her family.
Okay.
So it is for us, everybody talks about health equity at a system level, but for me and for TRI, we look at how we are, or a family is practicing equity within a family level. within the community
Interesting.
and giving the space to the woman, because that will make a lot. So that's the way into how we combine this micro and macro together and bringing the design view to create a holistic navigating system. So that's the way we are looking.
Because let's face it, if she's not given equal amounts or good amounts of food when she's pregnant, already from the get-go, that child is going to be on the back foot.
So that is one nice example which you have picked up.
Okay, give me another.
Taking rest itself is a very
Okay, rest is important as well.
That
yes,
a pregnant woman should take rest.
yeah.
But taking rest is not in her hand.
No.
So it has a very different dimensions with the economic activities, with her social norms, and her power within the family. So these three interplays as a came into a single thing, that sleeping or taking rest,
Yeah.
but it has a huge impact into the maternal health. So how we'll be looking it into a different angle, that how as a woman is treated, how she has been given the space, and how an enabling environment has been created within family, within communities. So that way it has to look in a holistically.
So you actually have to create a system change, a whole mindset shift, and then a system change.
Yes.
So tell me in practical terms, give an example of an initiative or a pilot program where you have done that, where you've taken this holistic view and you've said we need to shift mindsets and create a whole different change. Give me an example of how that's worked out.
See, I'll just give you one example that when TRI first started, then we had the way I had already explained you. What we have found? We had found that if we want to change or want to improve the health and nutrition status of the people, who can make it? It is the woman. And we have a firm belief that this country is not run by administrators, leaders, or someone else. This vast country is run by some of the volunteers, self-motivated people who in their own life take the leadership, they help others. And that's the concept we had started with Change Vectors. What we did a very simple interventions. We had traveled to many of the villages into the heartland of country in Madhya Pradesh, Jharkhand. In villages we had identified women who has basic instinct that they want to bring changes in their own life and they want to take leadership and influence the others' life.
Okay.
And based on few criteria, we had identified almost 4,000 women. We call them change vectors. Help them, equip them with knowledge, with skills and few tools, and help them to take the step within their own family, in their communities, in community spaces. And it has given a huge dramatic result.
And when you say take a step, you mean empowering, giving them knowledge about their health and knowledge about the services? What do you mean take a step?
So it is a three part. One is the knowledge, few skills like how to make plans, how to negotiate, and participation.
Okay.
So these three combined
In the community.
in the communities to put forward the agenda of health
Okay.
at the community setting.
Okay.
And what we have found, many people had questioned us that voluntary can it work? But after 5 years, it has proved that without any monetary support, women can take leadership, they can raise their voice, and they can make changes in their own families, in their communities. And the third party studies has confirmed that very critical areas of health indicators like diet diversity, ANC coverage, routine immunization coverage, those areas where our change vectors was active, there has the improvement is much faster, much better than any other places. That is the one thing. But most interesting is that almost 15% of our change vectors has been elected in the last panchayat elections.
No way. Oh, I just got goosebumps.
So you
wow, that's awesome.
you just see that how a woman is coming out from the home, they are changing their own life, helping their peers to influence and adopting scientific behaviors, accessing community assets, and access to the entitlements and government services, whatever is available in deep rural pockets, not only showing way to the others, but they themselves becoming leader in the local level.
Wow.
So that's the way we look, and that's the hope we see, that if this India has to change, it will be changed by this woman, by many more people, and that's the way we look, and that's the way we believe in that, how it will be happening.
Wow. And again, that's not just health, that's the whole picture.
Yes.
Yeah, yeah. I want to talk a little bit about something that is very big for TRI. We coined the phrase Samaj Sakar Bazaar. How does that factor in? Because again, we have this notion that, oh, health is just a government service. But you are already talking about how you're trying to make the community more interested in their health and put health on the agenda. Does Bazaar come into it at all?
See, it has three parts.
Mm-hmm.
One is the Samaj, which I have already described in many ways. So we look that in communities or in Samaj, that how the families and the communities, women, they are getting a space, raising their voices and adopting scientific behaviors. If it is, when it is come to Sarkar, it is the essential services which government is delivering.
Okay.
It is the entitlements which government is delivering, and also the facilities where the people will come and they will receive the services. The life would be saved. The third part is that is the market.
Okay.
In rural India, it is a very, very interesting fact. If we look the Indian entire health care ecosystem, here the private player play a very critical role. But all these big names are in metros. But in rural India, they doesn't exist. Big names doesn't exist. But there are definitely the other way traditional practitioners, and those are playing. But for us at TRI, we are looking at it in a differently. How we look? We look at it as a three angle. The first is that working with the startups, working with the innovations to bring the solutions to rural India, which can be available at the urban cities.
Okay.
So bring those new solutions to there, and we did.
And presumably that's good for them because it's a new market.
For us, we are not looking at it as a market, but rather we look at it as a giving a choices to the people.
I mean, to get businesses involved, the thing that would interest them is they have a market that they can be opened up to. No.
So again, we are looking at it in two ways.
Okay.
One is that that it is a new solutions are coming to rural India. So it is helping the new solutions makers or startup that how their product would be fitted to the rural India.
Okay.
How their market can be expanded with the way you are looking. But more than that, we are looking that it is giving a choices to the people. Because otherwise, in Delhi, I have many options. I can go to government hospitals, I can go to this brand, ABC, I have many choices. But in rural India, there is no choice. So therefore, we are giving and providing choice to the people so that they can choose from there. That is one. More than that, we are conceptualizing a new concept which we are calling as a care entrepreneurs. So the new solutions,
care entrepreneurs.
Yeah. So the new solutions which are available in the urban market, this in rural India has also changed. The new generations, the youths, young people, young women, they are all educated. They have gone to the schools, colleges, they have been trained nurse, and the other aspects they have trained, and with this skills mission, they have the skill can be upgraded, and they have already upgraded in many places. Can they take this new startup or new solutions to make their own livelihood and providing solutions to the people? So it is a new way to look and bringing solutions. One is that bringing solution to the rural India, that is one. And second is that from the solutions, how it is generating a new economy.
Yeah.
So that's the way we are looking that how that the new market solutions can come to the rural India.
A whole new workforce. A workforce is being created by this.
Yes, so we are looking in that direction only.
And just to come back come to demographics for a minute. Everybody talks about India's demographic dividend. Everybody talks about how it's got this massive youth demographic, but there's another demographic that's not being talked about as much, right? Which I suppose the care entrepreneurs could really feed into and have a lot of customers for.
So for us, we look at it differently. You have rightly picked up. It has the senior citizens.
Senior citizens, yes.
So what we have found that that compared to 1947 today now, Indians are living more.
India's what?
Indians are living a longer ways. So once we are living more, but the life is not healthy for the last few years.
Right.
And in rural India, many few things has fundamentally changed or changing. One is that a large section of the people are becoming old age. So there is a demographic change. People are living long.
Yep.
But once we are living long, it doesn't mean that we are living healthy.
Right.
So there is a portion of the life which needs the care. Again, traditionally in India, the care work has been taken by the women and other family members. But with the changing of the family patterns and the huge migration from rural India to the outsiders, so there are a large section of the people who require the care or the additional support. So we are looking that area as a new segment where the new solutions is required.
Yeah.
So we are finding here that care entrepreneurs and the family members with given the right skills and support, the life of the senior citizens can be more enjoyable, and it can be, what I'll say, that they can also have a more enjoyable life.
And these care entrepreneurs, are they earning a living because they're looking after other people's families, or are they looking after their own family?
So it has two ways. One is that care entrepreneurs will be filling this gap which exists in rural India for bringing the services to the doorstep or home-based services. But in other way, traditionally this work of care has been taken by two category of people, in particular in rural India. One is the woman and the second is the senior citizens or the older member of the families. Now the women, the new age, the new generation, they are also gone to the schools, colleges, they also have their own aspirations, but many times they doesn't have that opportunity to take up the step in their own life due to their engagement into the care works.
Yes.
So once they are into the care works, then their contribution to the economy, contribution to the families has gone invisible. So what
it's there, but it's invisible.
It is invisible. So therefore we are looking that if we can fill this gap with care entrepreneurs or similar kind of services or other solutions, then the women living in the rural India, having right kind of knowledge, education, skills, ambition, dream, they can take the next step. So we are looking, it is an opportunity to give the second chance to the women to start their new journey towards fulfilling their dreams and aspiration.
So they would be still doing work within their family, but they would also be earning a living outside of the family.
Yes.
Offering care.
Yeah.
And presumably they would be training other people in this role as well. Is that an aspect of it?
So we are looking at it in a holistically. So it will have a three kind of role. One is that those who are already trained, nurse and others, so they will be bringing a specialized kind of services.
Okay.
The second category is that allied services, like your physiotherapist or other kind of people. They will be bringing one kind of the second layer of services. And third category would be the general services.
Okay.
So in general services, we will be looking for and working with the young women and youths living in the rural India with right kind of knowledge and education to take that role. But these three together, these three category people together, they will be contributing, creating an enabling environment and filling that care gap which exists today.
Okay, fabulous. I want to talk about another idea that I think is close to your heart and the work that TRI does, and that's these mobile health units. And I understand that in some of the design thinking that you've realized that you can create these mobile units in a car on four wheels, but that doesn't always get to the most remote places. And I believe you're now trying to think of solutions and design mobile units that are two wheels. Is that in the works, or is that just a pie in the sky dream? Or is that something that you can actually think might happen?
So we are not looking at it as a mobile clinic. How we are looking it is the outreach services.
Outreach services, yep.
So what we are looking that in outreach services, one is the traditional point of care like Anganwadi centers and others, village health and nutrition day. So it is happening. But our understanding studies in Chhattisgarh, particularly in the services which is delivered at the bazaar or the marketplaces.
Where you put these health units.
Yes. So what we have found that it require a different kind of solutions.
Okay.
So therefore, with the team, the design solutions bringing team, the design leap team, what we have done that we have created a modular kind of thing. It is a which is movable and which can be used at any places.
Okay.
At a convenience. So that's the way we are looking. It has already designed and we are in a what I'll say that it is in a piloting phase.
Okay. All right. You've talked a lot about the community. So now I would like to for you to tell us what the new phrase that you've coined, the new phrase, how we're going to describe this is what?
We are calling it as a neighborhood of care. What we believe that which I am repeatedly and continuously saying for long is that health is not in hospital. Health is where our home is. So in to redesign or reimagine the health system in India or in any low resource countries, it has to be designed at home and it has to be nearer to the home. So we are calling it as a neighborhood of care. It starts with self, the self-care, care to the caregivers and changing the social norms. Okay. So that is the one piece of it at the family and individual. The next layer is your community. Okay. That where we are staying or where we are living. Our social connects, basic services, preventive services. So those things can be happened at the locality level. And third area is that nearby health facilities. So where we can get the basic level of services. So these three will combine together our neighborhood, and here we are calling it is a care for people, care for community and care for nature. Because with the climate change, with the changing of the demography and climate change, it will have a disproportionate effect into our life. So therefore how we interact with the climate like air, waste, water and most importantly with animals. Okay. In rural India, animals play a very critical role. Each of the households has domestic animals and with the changing scenario, particularly those who are living in close to the forest, the interaction with wildlife is also improving. And with COVID we have experienced that how the new kind of diseases, particularly genetic diseases can be come to human body. So in day-to-day life, adapting and practicing right kind of management of domestic animals and the wildlife we don't handle but we come into contact with them. So how it happened, it will have a future of health threat. So we are looking it is a whole holistically self, family, community and neighbor, and together we are calling it is a neighborhood of care. And we firmly believe that it would be the new way of looking the entire designing of the new way of health systems.
That's so fascinating, and it brings me to my last question, which is what role, since we are talking so holistically and looking at the whole of society here, let's look at the whole of the world and Mother Earth. What do we think climate change is going to have? What kind of impact is that going to have on rural people and their health? Is it related at all? You've just given us an example or two of how it's related. How else is it related?
So what I'll do here, that I'll not talk about that how climate change will affect the health. A lot of people are talking about it.
Okay.
But our looking into it, that how people are adapting towards the climate change. Okay. So with the extreme weathers, how people are prepared, how they are acting and how they are practicing it. Okay. So we are looking climate and health into that perspective.
What does that have to do with health?
See, if we again go back to that climate and the health, we look it in the traditionally we talks about the social determinants of health,
Okay.
like water, air, and
Nice.
waste, and nearby areas, the sanitation, wash. It has disproportionate effect into our health. And again, your flood and the new way of disasters and others. So with climate change, everything would be is changing. So with that, our living and the way we interact with the climate or our nature, it has to be looked in newly. So it has to be designed into that. But interestingly, in climate narratives, everything is about carbon, everything is about policy, and it is everything about in a very big talks. And I will not say it's a big talks, but it's a jargons.
Mhm.
But how we are looking at it differently, I'll give you one example.
Please.
That in a home, one mother holding her baby and cooking. So now, once he is cooking, the heat of the cooking is coming. Weather is extreme. Holding the baby and the emission of the carbon from the cooking that what I'll say that chula, it has changing her own environment within that small kitchen where she is working. So we are looking minutely from a woman perspective that in this micro level, how it is affecting to the health of the mother and the child. So we are looking climate and health not in a larger term, but rather we are looking at a very personalized way at a home and the surroundings and neighborhoods, that how it is affecting. If the water is scared and a woman has to travel along for collecting it, how it is she is compromising her own health for her own sexual and reproductive health. If she is carrying a bucket of water from 1.5 kilometers, she will get pain in her own back pain. So how it is interlinked? So our looking the climate and health from the woman perspective into the very personalized way and in very human way. So that's the way we are looking health and climate.
So follow that through for me. You're looking at that, you've identified these very micro issues, and then what? Are you designing a sort of system around that, trying to alleviate those stresses and pains? Is it just about informing women in villages that they shouldn't be cooking on an open stove while holding a baby? But that's impractical, perhaps?
No, that's where bringing this design thinking or design solutions.
Yeah.
What we are doing, that we follow a step-by-step process.
Okay.
Sitting with the women, with the communities, identifying the issues, identifying the barriers, and more than that, at TRI we always talks about dreams and aspiration, and what would be the future. And to achieve that, what are the systematic barriers that exist and how we can help them to navigate those barriers. And that's the role of designing thinking. So we are trying to design the solutions. We are calling it as a co-designing, co-decision, and co-evaluation. So everything has to be done with the communities, and that's the way we are applying the designing principles to finding the solutions, that how it has to be found.
Well, we end where we begin. We're right back at the beginning, which is fabulous. This has been such an interesting, impassioned and informative discussion. Thank you so much, Shyamal, for being part of this. Thank you for watching. I hope you don't just watch, but you share this. Give us a little like and send it on to someone else so that we can have more such discussions and bring you more solutions to development problems. Thank you so much. Thanks, Shyamal.
Thank you very much.
Thanks a lot. Take care.